Hey everyone, welcome back to ARC. Today we're going to talk about range of motion exercises following a total knee replacement. So the knee straightens and bends, really only two directions. So we'll cover a couple exercises to help you there. The first one we'll cover is getting your knee to bend. So it's going to be real stiff after surgery due to swelling and pain. So it's going to be real important that you start these exercises right away, because we really have a good 6-week window where we can really work on your motion without the tissue tightening down. So the right leg will be the leg that I'm going to demonstrate this exercise, but if you had a left knee replacement, you would just switch it around. So I'm going to hook my left leg over. So my right leg's the one that I had surgery on, the left leg is unaffected. I'm going to use my left leg to bend my right knee back, okay? And I'm going to hold that as far as I can for 5 to 10 seconds and then relax. And I'm going to repeat that. Hold for 5 seconds and then relax. And I'm going to do 20 of these, okay? And you're going to do these every 1 to 2 hours. So you'll likely get about five sets in throughout the day is typical. Okay, so hold at the end for 5 seconds here. Good. And 1, 2, 3, 4, and 5. Now there's a couple other variations to that exercise if that one just doesn't work for you. You can also do a kind of a chair scoot. So seated here, feet on the ground. You can slide your bottom forward and you can see how the knee just naturally bends there. Same thing, about 20 times, 5-second holds at the end there. Lastly, you can get a step stool. This one's a little bit more advanced where you can just kind of lunge into it. I would recommend the first two. This one tends to be a little bit more challenging, especially if you're unsteady on your feet. So back to that chair scoot, just slide your bottom forward as far as you can. You'll push into some pain, it's okay. This is one of the few diagnoses that we kind of push into pain a little bit and then back off. So slide forward, count to 5 to 10 seconds, and then back. Okay, so that's for bending the knee. Straightening the knee is just as important. So you may notice that because of the pain and swelling, it's really hard to straighten your knee. So anytime you're really not doing your other exercises, we ask that you sit with your knee as straight as possible, okay? Because if that knee doesn't get straight, you'll end up walking with a little bit of a limp, okay? So we gotta really work on getting that knee straight. So you can use a stool, you can use a chair, okay? Just prop your leg up and just let gravity gently work that knee down. You're gonna wanna start wherever you're comfortable. So just working comfortably up to about a 5-minute hold. So if you're only really comfortable for a minute or two, that's okay, that's where you start. And then as you get a little bit more motion, a little bit more comfortable, you'll begin to work up to that 5-minute duration. Okay, so really anytime you're not exercising or up and about, we really want you to focus on getting this knee straight. If you're gonna do it on the couch or on your bed, you really gotta prop your ankle up, okay? If you just do it here without anything to prop your leg up, because the bed and the couch are cushioned, it'll pull you, or it'll push you into a little slight bend here without even realizing it. Okay, so we really got to prop your ankle up on a towel so that there's some space between the knee and whatever you're on, okay? Just work up to that 5-minute time. It's okay if you can only do a minute or two to start, and really work on that anytime you're not doing your other exercises. Lastly, we're going to talk about this foot pedal. So you can pick this up at most sporting goods stores or online, and you know they're usually less than $20, so pretty affordable. But it really acts as a good way to keep your knee moving throughout the day. So if you don't have a bike at home or don't want to spend hundreds of dollars, this is a good alternative for you. So, and it's also a good alternative because I can slide it. If you're having a little bit harder time getting your knee to bend, you can slide it further away so that you don't have to bend your knee as much and you still get that nice fluid motion. So, work up to 5 minutes every day. Start with 1 to 2 times a day. If you notice that your knee swells, then drop your time and duration down. Okay. I would say most of my patients that get these foot pedals tend to do a little bit better in their recovery because they're able to keep their knee moving more fluidly throughout the day. So just nice, easy strokes here. If you're having a little bit of trouble going forwards, you can always certainly do reverse rotations. We're really not worried about strengthening here. We just want to get the knee moving, so it doesn't really matter which direction you go, whichever you're more comfortable with. And you just want to go at a nice even pace. If you're having a real hard time getting that knee to get all the way around, like I said, you can push the bike further away. Or if that's not an option, you can just do little half rotations, pushing as far as you can in each direction until your knee finally loosens up to get that full rotation. So give those a try. They should really help in your recovery process, and certainly ask us any questions if you have any. Hope you enjoy.